Hi, I'm Dr. Satine Patel. I'm a reproductive endocrinology and infertility specialist at Fertility Specialists of Texas. I'd like to talk to you today about some things that you might want to avoid during your IVF cycle. More and more research is suggesting that many factors in the environment can impair not just one's fertility, but one's general health as well. For example, harmful agents in cosmetics, such as sulfates and phthalates, can increase the risk of infertility and increase the risk of various cancers as well. It's very important to develop a healthy lifestyle prior to starting fertility treatments and IVF. It's important because excessive weight gain, increased insulin levels, or blood sugar levels can adversely impact one's fertility. For example, in women, it may impact a woman's ability to ovulate. It may also increase a woman's risk of birth defects during the pregnancy as well. Similarly, in men, excessive weight gain and obesity can lead to low sperm counts as well. That also could be associated with having low endogenous testosterone levels. While undergoing fertility treatment, I recommend my patients abstain from alcohol use and try to limit caffeine use to as little as possible. Alcohol use during pregnancy has been correlated with a syndrome called fetal alcohol syndrome, which could result in significant birth defects in the developing fetus. Intaking a significant amount of caffeine, and most of us feel that's over 200 milligrams or more than a small cup of coffee a day, can also increase the risk of a woman having a miscarriage. I always suggest to patients that when there's an opportunity to buy organic, especially for the dirty dozen fruits and vegetables, it's always a good idea. It's very important to avoid processed foods, refined sugars, and unhealthy carbohydrates, and routinely engage in cardiovascular exercise. By and large, most patients would significantly benefit from routine exercise in terms of fertility. However, it's very important not to be at either extremes. For example, patients with significant obesity generally have impaired fertility. Alternatively, patients that are extreme athletes can also have impaired fertility, and this generally involves impairment in ovulation for females. As a general rule of thumb, I counsel patients that if they have been following an exercise routine that they're accustomed to, it's usually fine throughout the treatment cycle, up till a couple days prior to egg retrieval. However, now is not the time to start a new exercise regimen or to start boot camp all of a sudden, going 0 to 60 in an extreme fashion, since that could lead to a significant stress on the body and ultimately can impair the success of fertility treatments as well. Prior to taking any new medications, it's imperative to consult with either myself or my team to make sure that the use of the medications will not impair with our fertility treatment regimen or potentially adversely impact the pregnancy. This includes not only prescription medicines, but also medications that are found over the counter, usual supplements that otherwise we may feel are benign, as well as herbs that your acupuncture doctor may give you as well. Small impacts to your lifestyle can reap big rewards in terms of fertility treatment success. If you think that you may be a candidate for IVF or would just like to explore overall fertility building options, I would welcome the opportunity to meet you.